Hello, my name is Joshua, and we are the Come On Now interns. During the past month, we've acquired extensive knowledge of telemedicine in the Kansas City metro area, and we're excited to share that with you today. But first, let's talk about Come On Now, its founder, and the mission behind this passionate small business. Our story starts with Dr. Shelley Cooper. After she lost her father because he was not able to receive access to the care he needed, she was inspired to create change in the community, bridging the gap between good quality healthcare and lower income communities. To solve this problem, she created Diversity Telehealth and Come On Now. These two companies have had a major positive impact on lower income communities. The two companies work in tandem to help provide healthcare access to everyone that needs it by means of a virtual service. This means that the process of visiting the doctor is 100% virtual. As we learned more about this service and talked about it with Dr. Cooper, we noticed a glaring problem. Even though Come On Now does a great job at serving the 180,000 uninsured people in the Kansas City area, there's still a population that we cannot reach. That is the 25% of Kansas Cityans without access to internet. This left us with one glaring essential question. How can we reach out to those without internet access to provide them with our essential telemedicine services?
Hello, my name is Jose, and our solution to this problem is a comprehensive 9-month plan to establish 3 new Come On Now community outreach centers. These centers will be safe places where both Come On Now and Diversity Telehealth patients who lack internet access can come to take their telemedicine appointments. We'll do this by partnering with already established community centers in the West Blue Valley, North Tempo Creek, and Dodson areas. We chose these 3 locations because according to the KC Connectivity Report, they are the biggest locations where the lack of internet access is stopping people from taking advantage of our program. Now, this plan encompasses 4 points. We will contact and partner with the community centers by September. In December, we will have launched our email campaign to find our volunteers and ordered all of the necessary equipment for the telemedicine services. This will all actually kick off in 2025, where in February, we will have launched the program. And if we see that they are successful, by August, we will have these clinics running full-time.
Hello, my name is Hrithik. During our time interning with Dr. Cooper, we were able to discuss about what goes into a telemedicine appointment and what the necessary equipment would be to fill our community outreach centers. Throughout this process, we were able to create a model of what the Come On Now community outreach centers could look like. Each room will be staffed by a volunteer, will have high-speed internet access, a computer, and other telemedicine equipment. An itemized list of the equipment will be displayed during the budget breakdown. Behind me is an AI rendition of what one of these community center rooms could look like. The final step of achieving our goal is our budget. Our budget can be broken down into 2 different categories: our startup pilot program costs and our long-term recurring costs. Our startup pilot program costs can then be broken down into 3 further categories: our computer equipment, our furniture, and our medical equipment. Our computer equipment will cost a total of $325 per room. Our furniture will cost a total of $60 per room, and our medical equipment will cost a total of $595 per room. In total, this will lead to a cost of $980 per room. This will then lead to a complete total of $2,940 in total for all 3 rooms.
Hello, I'm Jack. Now that we have addressed the startup pilot program costs, we can look at the formerly mentioned long-term recurring costs. This includes a $500 donation to the community centers we partner with. We arrived at the figure 500 because we found areas for lease for the same amount in the Kansas City area. We will also need a $50 for our steady Wi-Fi connection. We will pay these charges for each of the 3 locations, totaling to $1,650 paid monthly. Additionally, an emergency fund of $160 will be set aside for miscellaneous costs. This is what we're asking for: a budget of $13,000 to fund the half-year-long pilot program of the community outreach centers, and a steady Wi-Fi connection to support telemedicine services. We believe that with your help, we can improve Come On Now and make it a service that is accessible to everyone and bridges the gap between those with and without internet access in terms of receiving quality and outstanding healthcare. Thank you for your time, and if you have any questions, please feel free to scan the QR code behind me.